On behalf of the Patient Safety Authority, I would like to welcome you to this webinar titled The Impact of Environmental Infection Control Rounding on the Safety of Patient Care. My name is Amanda Bennett, and I will be your moderator for this program. We welcome any comments or questions. All materials are provided for your educational use. Now I'd like to introduce our speaker for the webinar. Denise Cutting is a registered nurse and infection prevention advisor for the Patient Safety Authority. In this role, she serves as a resource for Pennsylvania facilities through education and the development of infection prevention initiatives. Denise's clinical experience includes medical, surgical, telemetry, and performance improvement. Prior to joining the PSA, she was the regional manager of infection prevention and control for the Geisinger and Penn State Health System. None of the planners for this educational activity have relevant financial relationships to disclose with ineligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by or on patients. Denise, I will now turn the program over to you.
Thank you so much, Amanda. And thank you everybody for joining today. I know you all have very busy schedules, so thank you so much for taking some time today. So we're going to talk about 3 different objectives today with the primary focus on OR rounding, but the things that we talk about today can be applied to all different types of settings. So we're going to identify key components of environmental infection control rounding and the impact it has on patient safety. As we go through, we're going to talk about strategies to improve infection control practices while you're doing your rounding. And we're going to discuss the impact of healthcare associated infections, how the environment can impact healthcare associated infections. So when we're doing environmental rounding, it is really a team effort. So it can't be done just by one person. It involves infection prevention, facilities, environmental services. Anybody really that can help impact what is going on in the environment needs to be involved. Leadership, of course, is really important. Patient safety, frontline staff. It's pretty interesting sometimes when you're out and about doing environmental rounding, the things that people will tell you. So it's really important to get out there, look at the environment, and see what's going on that may impact the safety of your patients. This is so important for so many reasons. It is part of the competency model for infection prevention. So this is one of the core competencies of an infection preventionist, the ability to go out into the environment, identify risks, and make suggestions on things to do to correct those risks. And as we just said, the environment has a direct impact on patient outcomes. Really, it is like this anywhere you go, but especially in healthcare settings, especially in operating rooms, the environment will impact how the patient does. And we know healthcare associated infections are a leading cause of morbidity and mortality. So we need to ensure that we are doing everything we can in our environment to prevent healthcare associated infections, because it really is incredibly, the impact it has on patients is really important. And the other thing that happens in our environment, if we see the same things every day, we may not notice that it's a problem. So sometimes having somebody else come around to have a look at things will help identify concerns that maybe you didn't realize were there, because it's something you see every day and you just kind of become accustomed to it. So there are several different things you want to look for when you're out doing environmental rounding. You want to look for water intrusions. We're going to talk a lot about that. Supply storage and expiration, how linen is stored, sharps, how those are discarded at your facility, blood glucose monitoring, also really important. The cleaning of the environment and equipment, high-level disinfection and sterilization. We're not going to get into a lot of detail about that today in this webinar, but there is another webinar that you can view that gets into more detail, and the link to that is in the PowerPoint slides towards the end. We're going to talk about medication storage. And then, of course, hand hygiene. Wouldn't be an infection prevention presentation without talking about hand hygiene and isolation practices. So, just how to incorporate those as you're out and about doing your rounding. And as we're going through today, please do put any questions you have in the chat, and we will address those as we go through today. So water intrusions, we're going to spend a little bit of time talking about this. We know that this happens more than we would like. Pipes break, sprinklers can break, and it causes a lot of problems. We know that bacteria and mold love water, and it can cause so many problems for the environment and for our patients. So we're going to go through a couple of these. Obviously, there's plenty more bugs that live in the water that could impact your patients, but we're going to talk about just a couple of these. So Legionella is one of those that I'm sure you all have heard about. It can infect a patient through inhaled droplets, or of course, we know if they are in an environment where it's in the air and they're open for a surgical procedure or anything like that, it could impact them that way. Most of the bacteria that we're talking about here now are gram-negative. Those are the ones that tend to love water the most. So anytime we have any water intrusions, I mean, this is a pretty drastic picture of what can happen, but it can be much smaller and still lead to these kinds of problems and development of these bacteria that can impact our patients. Another one that comes from water is Acinetobacter. This is especially opportunistic, and it will infect a patient's lung, blood, wounds, of course, or urinary tract. And some of these bacteria, especially as this one, can develop resistance to antibiotics, especially third-generation cephalosporins, and it can have a carbapenem resistance. So important to make sure that our environment is clean and we're aware of any of these types of situations, because these types of infections, if they get into a patient's wound, can be really, really detrimental to the patient. Serratia. Serratia marcescens most of the time is what you may see. Another gram-negative bacilli, and generally it lives in water. So all these bacteria, live in water, soil, and the environment, but when they get into a healthcare environment, they get into an operating room, it really can be problematic for patients. And again, this Serratia can also be multi-drug resistant. And any of these bacteria, once they get into the environment and aren't properly cleaned, can be transmitted. So transmitted on staff hands, contaminated devices and surfaces. Pseudomonas, pretty common bug that lives in water, but also can be resistant to antibiotics and can lead to death. So in 2017, Pseudomonas infections led to 2,700 deaths in the United States. So these types of infections happen and really impact patients. So aspergillosis is a fungus. So, not a bacteria, but a fungus that often we see with water intrusions. In most situations, we encounter these sorts of things throughout our lives without any negative impact. But whenever it's somebody's immunocompromised for whatever reason, or in a healthcare facility having a procedure, we don't want to introduce any of these bacteria or mold into their bodies, causing systemic infections and really poor outcomes for them. So not only do, other places that water can impact a patient would be ice machines. So, we know that most facilities have ice machines, and especially Legionella. can lie dormant in ice machines. So another thing to kind of consider when you're doing your environmental roundings is looking at your ice machines, how they are cared for, maintained at your facility. There needs to be a cleaning process for those as well. So if something like this would happen, you have a water break at your facility, you know, it's most likely not going to be clean water, right? It's not going to be your critical water that's going to go out, you know, into your facility. A lot of times it's not clean water when these sorts of things happen. So really important to make sure that areas are adequately dried if something like this happens, because these bacteria can live on the surface for long periods of time. Just a couple examples. Pseudomonas can live in the environment for up to 16 months, and Acinetobacter, 11 months. So long periods of time if areas aren't adequately cleaned after something like this might happen. So we're going to move on to storage. So I have a question for you, polling question. So this is a picture of a storage area, maybe similar to something you have in your facility. So if you could please take a look at this and answer the questions here. What is done well in this picture? So some examples. So choose all that apply or none that apply, whatever you think. So in this picture, do the shelves have solid bottoms? Items are labeled. Storage bins are used. Items are stored in corrugated boxes, or nothing. So take a look, see what you think, and we'll get into more detail about what's going on in this picture. Shelley, if you want to close it out, and let's see what you think. So yeah, storage bins are used, which is generally a good idea and what we see when we're out rounding. Items are labeled, important. We want to make sure we know, what we're looking for. So in this picture, it's a little bit pixelated, a little bit hard to see, but you do want solid bottoms on your shelves. So in this picture, it doesn't appear that there are solid bottoms on the shelves. And generally, we don't want to store items in corrugated boxes. They can harbor bugs, bacteria. So generally, we want to move items from corrugated boxes into storage bins. And a couple of you said nothing, so and that's okay. It's not the worst I've ever seen, but there's definitely some opportunities if you would see something like this out in your environment for some improvement. So storage bins are good, they are better than corrugated boxes, but we need to be cleaning those storage bins, which is not something we often think to do. So storage bins are good, but there needs to be a process for those to be cleaned on a somewhat regular basis. Some people do monthly, but there needs to be some sort of process for cleaning the storage bins if you're using those at your facility. I already did mention the corrugated boxes, so just, really and on the bottoms of the reason for having a solid bottom on storage bins like this or storage areas that have wire shelves is when you're mopping the floor and cleaning, you want to make sure that the items that are on the bottom shelf don't get any moisture from that cleaning process. So that's the why for having solid bottoms on shelves. So some facilities that may have storage bins on the bottom shelves, that can help because you have a solid bottom in those storage bins. But you really wouldn't want, especially, you don't want corrugated boxes, and you especially don't want them on a bottom shelf where they can get some moisture, as we just talked about how that is not a good thing to have in a healthcare environment. So another area that you want to look at when you're out rounding is how medications are stored. So your refrigerators need to have monitors for temperature. Some of those are electronic. Not everybody has an electronic way to do that, but if you do, that's a good way to make sure that your medication storage refrigerators are at the adequate temperatures. Expiration dates, appropriate labeling for different medications. And as we just kind of talked about with storage bins, your refrigerators need to be cleaned, and who is responsible for that cleaning? Because not everybody has access to medication storage areas. So there needs to be an identified process as to who's responsible for cleaning those spaces on a somewhat regular basis. Whatever works for your facility, ideally you'd have something like that in policy and process so that everybody is aware of what needs to be done. So as this is a picture of medications in a refrigerator. Medications are obviously stored outside of refrigerators, often in medication storage rooms. And a lot of times there's sinks in those spaces as well. So as I've already talked about how important moisture and water and how important that is to avoid for your facility. Splash zones around sinks are important to make sure you don't want any of your medications or sterile products around sinks, because that dirty water that's in the sink can splash out into those areas. And under sink storage, you want to make sure you're not putting anything under a sink, because we know moisture can get underneath those sinks as well. Ideally, you want to lock underneath sinks if you can, so that people don't use those for storage, because people will, because there's never enough storage wherever we are. Expiration dates, especially for medications, we know that, and the FDA has said that the importance of expiration, it's based on testing and evidence for that manufacturer of that medication. And it instills confidence that the medication is effective. So these products, and the reason we have expiration dates on them, is because we know that product stays at its strength and quality and purity for that period of time. So whatever period of time has been identified by a manufacturer is why we have these expiration dates. So we know over time things can degrade, may not be as the same strength that we would want it to. So we need to ensure that we are looking at our products, looking at our supplies to ensure that we don't have anything that's outdated. I know I wouldn't want a product used on me or my family member that may not be as effective as it could be if it was not out of expiration. So I know that this is a concern because of waste, and it can be expensive if we have things that expire. There are some areas that will take donations of expired things. I've heard of animal shelters, some other things where these things can be donated to so that they don't have to be thrown away and wasted. So, if there are places, if you have things that are expiring, you may be able to kind of donate or repurpose to another purpose. So we see linen when we're out rounding, and we know that clean and dirty linen needs to stay separate. We know that we never want to carry dirty linen against ourselves, and we know that linen needs to be put into especially dirty linen, of course, leak-resistant containers. So I hope that none of you see linen like this in your environment, but it happens. Again, there's never enough storage. There's never enough space for all of the things that we need. But your facility needs to have processes in place for handling linen safely. Your scrubs, we want to make sure that any clean linen stays clean. So whatever, linen needs to be covered. We need to be touching clean linen with clean hands. Hand hygiene before we're touching any clean linens. And dirty linens, any storage containers for dirty linens also need to be cleaned and disinfected on a regular basis, whatever makes sense for your facility. So there needs to be a process in place for cleaning carts for dirty linen as well. Sharps containers. We know, some of your facilities may have many different types of Sharps containers. The large red ones that sit on the floor or wall-mounted Sharps containers, but they need to be removed from the environment when they're 2/3 full for safety. We would know that we don't want to be trying to put Sharps into a container that's overflowing. And we need to be careful with Sharps containers and the types of openings that they have on the top. A lot of the big red storage Sharps containers that you see in operating rooms have those large openings on the top, which wouldn't stop somebody from putting their hand down inside there if they really were after something that was put in there. It's happened. You hear stories about things that happen that are really just not good. People will do some crazy things and stick their hands down in Sharps containers. So really important to make sure that they stay covered as much as possible so that you don't have people putting their hands down in those. And if you have, Sharps containers in environments where there's children or family members visiting, you want to ensure that those are covered adequately, because I've heard some stories over the years about situations where children have stuck their hand into a Sharps container. So really important to make sure we're keeping these covered as much as possible to keep everybody safe. So in the resources section of this presentation, there's a link to a document that has these details for healthcare waste classification that includes information on this slide and the next slide. So there you can access that document from the slides in the resources tab. So this just kind of goes over the different types of waste in healthcare and where it needs to go. So most things in healthcare can go into regular waste. So clear or black bags. So we even dressings, IV tubing, IV bags can go, once they have had patient information removed from them, can go into clear bags. So there's more than you think, even in the operating room, that can go into regular waste. So I would encourage you to take a look at what you're doing. If you're putting everything in red bag waste, it doesn't always all need to go there. So make sure that you're taking a look at, and this was posted in the chat. So, take a look at what you're doing, because we know red bag waste is expensive, and, everything may not need to go in there, even PPE. So, throughout COVID, we were maybe putting all of our PPE in red bags, not something we need to do. So take a look at what you're doing, because there may be some things that can go into regular waste. But of course, there are things that have to go into red bags. So things that are heavily saturated in blood, so dressings that are soaking in blood, need to go into red bag. Blood tubing needs to go into red bag. So things that are saturated in blood need to go into red bag trash. Visibly soiled PPE. So most of the time PPE is not visibly soiled, but if it is, it would need to go into red bag. And Sharps, if we have, we talked about Sharps containers, and then the things that need to go into the Sharps containers are empty syringes, obviously needles, blades, razors, scalpels, anything like that needs to go into Sharps waste. So this is kind of one of those bigger containers that has one of those larger openings on the top in the picture here. And there's different pharmaceutical waste, different, obviously, chemotherapeutic waste, and definitely you want to work with a pharmacist to make sure that your pharmaceutical waste is getting into the right place. So there's pharmaceutical waste, hazardous pharmaceutical waste, and the chemotherapeutic waste. So depending on what you're using at your facility, you may have different medications that need to go into different places. So you want to make sure you're working with a pharmacist so that you're getting the right thing in the right waste container that it needs to go in. So pretty much every facility is doing some sort of blood glucose monitoring. Even if you're an outpatient surgery area, You should have a glucose monitor for situations where you might need to use one. And we know that and this is a alert from the Department of Health from 2022, where there were situations where blood glucose monitors are not being cleaned between patients. This is a risk for bloodborne pathogen transmission because we know that we're using those machines, they can get blood on them, and that can be transmitted from one patient to another. So it is really important that we have a good process in place for cleaning glucometers at our facility. They need to be cleaned per the instructions for use for that glucometer. So there's all kinds of different instructions out there depending on what kind of glucometer you have. And we need to follow those instructions for use to clean the glucometer between patients. Sometimes it's a little bit cumbersome depending on what type of device you have, but really important so that we're not transmitting, hepatitis or any other type of bloodborne pathogen between patients. And it's happened, which is why this alert came out in 2022. So again, this alert is the full details of this is linked in the resources of this presentation. So there are some recommendations from the Department of Health, making sure you have policies and procedures in place. Educating about cleaning and disinfection of the glucometers, making sure the staff know what the process is for cleaning those, and looking at it. So when you're out in the environment, asking people, how do you clean this glucometer? And asking them to do it and see if they're able to clean it the way that it's supposed to be cleaned. And any breaches need to be reported to the Department of Health if there are any issues with glucometers. We know we need to handle glucometers with gloves and perform hand hygiene, whenever we're cleaning and in between patient use for these machines. So this is really important, and I think that it's one of those things that often gets missed because we just kind of wipe it down and we move along, but it's really important that they are thoroughly cleaned and disinfected between patient uses. And hand hygiene, of course. So anytime we're out and about and rounding, we're going to be looking to see that staff are cleaning their hands as they should. So, before interacting with a patient, we want to make sure that staff are cleaning their hands, that they have the products that they need where they need them. So, I don't see this as much anymore, but really important that you have hand sanitizer where you need it, as close as you can to the patient for those points of use whenever you're interacting with the patient. That we're changing gloves and cleaning our hands between clean and dirty activities. And that we're monitoring all different staff at different times and how they're doing with hand hygiene. We know that this is the #1 way that we spread infection in healthcare facilities. So it is one of the most important things we need to be doing when we're out and about doing environmental routing. And ideally, you want to have some secret shoppers looking at hand hygiene. Because I know when I was out doing environmental rounding, people knew that I was watching to see if they were cleaning their hands at the same time while I was out there. So it was just kind of a reflex, people would see me and they'd clean their hands. So important to have people doing this maybe when they don't know they're being watched, just so that we know and we can educate them about how important it is. And that on-the-spot education really can be helpful, to your staff about how important hand hygiene is. Again, we get into our routines and we're busy and we're trying to move quickly, and sometimes we forget, but this is so, so important. And especially in the surgical areas. So not only do we need to be doing hand hygiene, surgical scrubs, but our nails need to be a certain way in operating rooms, especially in the scrub roll. So many, this is a struggle for a lot of places. Because a lot of people are getting, get their nails done, get gel, acrylics, whatever it is. but it is really important to have natural nails as much as possible, especially for those that are doing the scrub roll in the operating room. And as we talked about earlier, those hand hygiene stations and where things are, because we know the water that comes out that we're using to clean our hands may have pathogens in it. So we want to make sure that the things that we need around these hand hygiene stations are not going to be splashed with the dirty water that is coming out that we're using to clean our hands. You may have different products. There are so many different products out there. And if you're using something and people aren't really happy with it, you know, take a look and see if there's something else maybe that would help you at your facility for people to be more compliant. You know, if you have something that is really difficult or hard on staff hands, you know, there may be something else that you could use. And, you know, try to get creative to help people do hand hygiene the way it needs to be done. So, you know, there's all different things you can do, you know, incentives, rewards are good ways. Positive reinforcement, you know, it doesn't always have to be negative when we're out and about. So we can reward people for doing the right thing as well. So the environment, this is specifically, you know, looks at an operating room. We need to ensure that the environment is clean. So one of the things I often see when I'm out and about is dust in high areas. So really important for those that are cleaning the environment, especially in the operating room, to have an understanding of what they're doing and how it could possibly impact a patient. You know, people just get busy and they get in their routines and they sometimes forget about the importance of what they're doing and how it can impact a patient. So helping those that are doing this cleaning to understand how important and how valuable it is that everything is cleaned effectively in the correct process, right? We go from dirty to clean, high to low, you know, following the right processes that we know about in certain areas is so important. Also knowing who cleans what and what is clean. So in this picture, is this bed clean or not? I don't know. So is it a bed that is just sitting out of the OR for a patient to go on whenever they come out of the operating room? Maybe, I don't know. But how do we know a piece of equipment is, if it's in a hallway, is clean or not? So most places have, you know, storage rooms, and we know that items in those storage rooms are clean. But when they come out into a hallway, if they're waiting to go into an OR, you know, how do we know that somebody doesn't touch that as they go past with unclean hands? You know, what is the process? So really important to kind of take a look at this for your facility. Items that are taken into and out of operating rooms, we need to know whether they're clean. What's your process? Do you clean them right before you take them into an operating room? Do you clean them when you take them out of an operating room? Do you do both? You know, what is your process, and is everybody following the same process? Is the process standardized across? And in the environment, who is responsible for cleaning what? So what is environmental services responsible for? What are your staff responsible for? Making sure everyone understands their roles and who is responsible to do what and when. And we need to observe all of these processes when we're out and about doing environmental rounding. So inside the operating room, same sorts of things. You know, who's responsible for cleaning the lights above the table? Who's responsible for cleaning the table? What sort of products are you using to clean your environment? What are you using in between cases? In between cases is the product you're using, what is the dwell time for the product that you're using, the contact time? how much time does the surface need to stay wet for the product that you're using? You know, I've seen some products out there 5 minutes, 10 minutes. Is that happening in between cases? Because we know you're moving fast and things need to be cleaned quickly. You know, you got to turn over that room quick. So is the dwell time, the contact time for the product you're using being observed? Because that will tell you whether you're actually cleaning the environment adequately or not. Because we know that, say you're using a product that has a 2-minute dwell time. The manufacturer has tested that product to ensure that during that time, that 2 minutes that the product is in contact with a surface, that it is actually killing the bugs that it says it's going to kill. So if you use a product and you only let it have a contact time of 1.5 minutes and it's supposed to be 2 minutes, there's no way to ensure that you're actually removing those bacteria from the environment, the multi-drug resistant organisms from the environment. So it is so important that we are observing and cleaning adequately between cases, and of course terminal cleaning, that we're observing the dwell times that were identified by the manufacturer of whatever cleaning product we're using. And if we have a product that has a really long dwell time, is there something else we can maybe look at using that would be more effective and more user-friendly for the staff? So there's a CRM in this picture, you know, and that's one of those pieces of equipment that'll go in and out of the room. Now we know it doesn't, you know, it doesn't come in contact with a patient, but it might come in contact with splashes or other things. So when is that CRM cleaned? Is it cleaned before it comes out of the room, when it goes, and then it goes into a clean storage room, or is it cleaned when it comes into the room? You know, things to think about at your facility and what your processes are. And again, is it standardized and is everybody doing the same thing? We need to inspect surfaces to ensure that they are, that they don't have any holes or tears, because we know that foam can't be cleaned. So especially in your operating rooms, your stabilizers, a lot of those can get cracks and they can't be cleaned adequately if they do have cracks in them. You know, beds, all kinds of things, whatever it is, we need to be able to clean it, and this will be one of those examples where it can't be cleaned. So we need to not only look at the big picture of the environment, but looking at things more closely to make sure things are intact so that they can adequately be cleaned. So as we're doing our environmental routing, we want to make sure that isolation practices are followed. You know, do you have a patient that has C. diff that may need a procedure? It happens sometimes. So are we following appropriate isolation practices? Do we have signage so that everybody knows that this area needs to be cleaned? Because if you don't have a product that has a kill claim for a particular type of bug, you know, some facilities may need to use a different product depending on the situation. So, you know, because C. diff, we know we need bleach. You know, do we have a product and are we observing the dwell times for that product if we need to in that situation? And we know we have we have PPE available in operating rooms, but do we have it available where we need it for certain things? And as I said, the cleaning and disinfection, you know, making sure that we're cleaning and disinfecting. Do we treat everything as if it's a multi-drug resistant? Do we have a product that would kill everything? And if you do, that's great, but still also important for people to know if there's any additional precautions that may need to be taken. So as you're out and about there, you want to track what you're finding. So you need some sort of audit tool to help you keep track of what you're seeing and whether things look good or if there's an opportunity for improvement. This is just an example. Again, this is linked in the resources. There are lots of different types of tools out there that can help you as you're doing your environmental rounding. There are electronic versions. You know, if you're part of a larger system, maybe you have access to something electronic that you can use on an iPad or a tablet, something like that. Some of these are, you can do work orders directly from them, or it will send an email directly to somebody if they're not there with the rounding, to get things addressed in a more timely manner. But you can certainly use paper, and it can be effective in helping you to keep track of all of the things that you want to look for. So one of the things we haven't actually talked about is, the exam and treatment rooms or your waiting room. So also something you want to make sure you take a look at with your rounding, and making sure those areas are clean, and your environment is, you don't have broken chairs or chairs that are torn, even in your waiting room, to make sure that things can be cleaned adequately in that space as well. So just one example, but there's plenty out there that can help guide you as you're out doing your rounding on all of the different things to look for. So as I said earlier, there is a webinar that's available on our YouTube channel that goes into more detail for instrument cleaning, sterilization, and storage, high-level disinfection. So that is available. You can go and take a look at that if you would like. And just to kind of reiterate what I said at the beginning, this is not something that can be done by one person. This is really something that, needs a team approach. You want to have a schedule. Generally is a good thing to have, but it's also a good idea to do impromptu environment of care rounding, so you see maybe a different shift or a different time of day, or if you have a schedule that kind of rotates so that you go to different types of areas. And you need follow-up for certain things. So, if something needs to be repaired, you want to have a follow-up time for that. And you need to report your findings to your infection control committee. And also any concerns you have, you need your leadership involved to help you, address things as they come up. And your physical environment really is important and has the ability to prevent infections for your patients. So environmental rounding provides valuable information about everything that's going on within your building, with the equipment that you have in your building, and how staff and what staff are doing. So again, so important to just get out there and see what's going on, so that you can help improve the care of your patients and improve, staff love seeing people come out and about. They may get a little nervous, a lot of times they're, wondering why are you here? What are you looking for? But, as you're out there and they get more comfortable seeing you, they'll tell you things that really may impact patients, and it can improve the overall patient safety for everybody. So with that, we will take some questions. So please, if there's any questions you have, if you want to put them in the chat. And Amanda, if there's any questions that have come up, we can circle back to any of those.
Thanks, Denise. That concludes the slide presentation portion of our program. Now we would like to begin our question and answer period. There is a question here. Do you have any suggestions or tools to keep track of rounding results for that need follow-up or repeat issues?
Yeah. So one of the ways, if you don't have access to electronic versions, good old Excel spreadsheets is what I tended to use when I was out and about. And, setting yourself, sometimes sometimes we do have to ask people maybe more than once for something. We're all busy, we all get lots of questions, lots of things we need to do. So, and an escalation process. So, if you have an issue that needs to be addressed and you've directed it to the person that should be addressing that issue, if it's not addressed by the time that you are asking for it to be addressed, then, you know, maybe escalating that to a leader, getting their involvement, and, you know, taking it to your committee, as I said. So if there are ongoing issues that you can't get resolved, you know, escalating those to different venues to try to get them addressed. And sometimes, you know, it's not always easy. I know that for sure. But sometimes you might have to take things different directions if you can't get where you need to be.
I would second the use of Excel files, Denise. I know that I would always sort of keep one saved for each location as I was doing it. And then when I would go back there the next time, it was always nice to sort of look at what we found, because whatever we found, whether it was fixed, you know, with the last rounding, it was maybe a weak spot that I'd want to keep an eye out for to make sure that it wasn't something we just fixed in the moment, and that it was actually fixed so that it wasn't happening again. So it was always nice to have that historical data to follow up on things. I definitely found that useful, because I certainly couldn't remember everything when I was rounding on all the locations. We do have another question here. I have heard that the FDA is changing recommendations on expiration dates. Can you comment on that?
Yeah. So there's been some things that I've seen out, you know, about the FDA and them looking to, but actually the FDA doesn't require expiration dates, and mainly what they're talking about is food. So the only thing that the FDA regulates medications, of course, and infant formula. But other than that, it's they don't really require expiration dates on food products. So some of those, like and it's inconsistent, you know, kind of what you'll see on food products, whether it's a use by date or best before date, or I have a yogurt that I like and it'll have a date on it, but then it actually says it's good for 7 days after the date. So it's just really, as far as food labeling goes, it's really inconsistent. So I think that they're looking to maybe look at a way to kind of streamline how that is done for foods. But for medications, the FDA is involved in that, and that is regulated. But for food, and it's not. It's kind of all over the place. So.
Okay, so there was another question here. Do you have any sample checklists for rounding?
So in the resources tab here, or the resources slide in the presentation, the second one down here is a sample checklist for rounding that you could alter. I think it's an Excel form that you could alter. There are others out there. This I just thought was one good example. You know, you may have areas at your facility that you don't, maybe you don't have certain areas, and you wouldn't need to, you know, you can alter the rounding sheet for your needs. Or if there's something at your facility that you want to make sure you take a look at, you can add that to a worksheet. So there are others out there that I'm sure if you went out and, you know, Googled it, you might find some other things. But the second one here on this list from Spice is a pretty good place to start.
Okay, thank you. I am working on putting that link in the chat so that everyone has access to it. Everybody should see that now there. One other question is, what about patching equipment? Like if we have positioners that get holes in them?
Yeah, I saw this recently in an APIC chat. So there are, again, I'm going to say the FDA, there are FDA approved patching, I guess, products out there by different manufacturers. Now, the infection preventionist in me gets a little bit concerned about these sorts of things because if you're putting a patch on something, there has to be some sort of, I don't know. I mean, I don't have personal experience. I've not used one personally, if this is something you're looking at using at your facility, you want to make sure you do a risk assessment, and, take it to committee for review, all of those things. So, I think some people have been successful in using these, but I get a little bit concerned from an infection prevention standpoint. But if it's something you're looking at, you just want to make sure you go through a good, thorough process to ensure that it's something that would be safe to use for your facility.
I can add here to this. I did work in a previous facility that we had used some patches that, I'm not sure if it's the same thing you had seen, Denise, but they did look really great. It was almost, you couldn't even tell that it had been patched. So I felt comfortable with those from an infection prevention standpoint. But, I've also seen staff who think that duct tape is a good patch. So we just have to make sure we're really aware of those things and making sure people understand what they can and can't do, because I agree, Denise, a lot of those adhesives can be concerning when we're looking at how to patch things. I did want to add to what Denise was saying at the end of her presentation, that I agree that these environment of care rounds are really good for getting to know your staff and helping them to feel comfortable with you. When we got EMRs, it was great to make a lot of our jobs easier, but one thing I definitely felt the loss of was being out on the units as much and having those conversations and being looked at as part of the team. And I think the environment of care rounds was really a great way to do that and to integrate yourself into the unit. We did get a comment here, tape on walls or boards are an issue. Are there suitable products?
Oh yes, tape is always always on our list from an infection prevention standpoint. It really kind of depends on what, I know I always say that, but if there are ways, magnets tend to be better because they can be wipeable. So if there's ways to use things that are magnetic, if you can use, if you're taping up papers or, obviously laminating things, so that they can be wipeable. Sometimes you have to get creative. I don't know, Amanda, if you have any other suggestions.
Yeah, I'm thinking too, when it was specific to doors or rooms that we wanted to hang things on, you can always use over the door hooks,
Yes.
which, might not be the most convenient, but that was something that we could do. Yeah,
And using, like if
tape
you
is a
have
problem.
yeah, and if you
We
have
have some comments. Oh, go ahead.
things to hang, yeah, vinyl paper, if you can put,
Yep.
yeah, command strips and, putting a ring through something and hanging it, those sorts of things can be helpful. And there's a question about clarifying recommendations for solid bottoms on shelves. The shelf closest to the floor. So, if there are things on a bottom shelf and it is not and it's a wire shelf that does not have a solid bottom, when the floor is mopped, as it should be, right underneath, sometimes moisture goes up into whatever is underneath on that shelf. So there are plastic, basically just plastic liners that you can put on the bottom of your wire shelves to ensure that anything that's on that bottom shelf will not have moisture get onto it from underneath. Most
And
I
I think
think you can purchase from the manufacturer of whoever makes those shelves. I think most of the time.
And I think for this question, they're asking, is it for all the shelves or just the bottom shelf? So it would just be the bottom shelf. You don't need to add that to every shelf above.
That's right. Thank you.
Okay. Yep. If there are no more questions, then somebody just said we use painter's tape to hang images, reports on our doors if needed. How do you feel about painter's tape, Denise? I was going to say it's
my nose
better
up a little
than
bit.
regular tape, but I don't love it.
No, I don't love it either, but
I mean, it's not going to leave adhesive when you pull it off the way other
yeah,
tapes would, but it's still not really a cleanable surface necessarily.
yeah.
And then someone said we have Acrovin doors, which I'm not actually sure what that is. I will have to Google that when our webinar is over here. I want to thank everyone for joining us today. If you experienced any issues accessing the evaluation or a certificate of continuing education, please feel free to direct any inquiries to Shelley Mikesell at shmixell@pa.gov. This concludes our webinar.